Now with Dr. Jennifer Ashton and law enforcement analyst Evy Poumpouras with more on how to talk to your children about this tragedy. As parents and children across the country, they're understandably scared and they're struggling to process all of this. And thank you both for joining me. And Dr. Jen, you've dealt with trauma in emergency situations. Even students who don't go to Parkland, the school in Parkland, Florida, they may be scared to go to school this morning. So
Absolutely.
As a parent, how do you soothe your children's fears?
Well, I think, lessons we can take from physical trauma can be extrapolated to psychological trauma. And the first thing is the caregiver has to take care of him or herself first, because your children will pick up on your fear or anxiety. So if you're not in a good place to have this discussion, wait until you are. Secondly, I think we need to find out what they've seen or heard on social media, because that's a new aspect to this shooting that we haven't seen as vividly in the past. The conversations, Michael, have to be age appropriate, and they have to be temperament appropriate for your child, because children have different sensitivities. And I think then we have to reassure them that even though bad things happen, they are safe, and we have to remind them that their feelings are not dangerous. They have to feel safe to express those feelings. And lastly, we can't emphasize this enough. If you feel overwhelmed as a parent to handle this, please bring in trained mental health professionals, social workers, psychologists. They are experts in this. This is what they do best.
And if you're overwhelmed as a parent, imagine your child, the overwhelming feeling they must feel. And Evy, you counsel schools in situations like this, but not all of them have a plan in place. So if your kid is unfortunately in a situation like this, how do they handle this type of emergency? What would you suggest?
All right, so first you want to move away from the sound of shots. You may not be able to see the shots, so wherever the sound is coming from, you want to go always in the opposite direction. If you can evacuate, that's the first thing you want to try to do. But sometimes you can't evacuate. So find somewhere to harden up, meaning find a room, a closet, close the door, lock the door, barricade the door, and move away from any windows where anybody could see you. And you kind of just stay there and you stay put while you wait for help.
And you kind of alluded to social media, and almost every teen has a cell phone now. So in situations like this, Evy, what are the do's and don'ts for kids when they're dealing with social media?
So when this is happening, this is the one time in your life where you must be self-aware, where you should not be on your phone. You should have all your senses so that you know what is going on around you. First, take your phone and put it on silent. Everybody's going to start calling you, so you don't want to give away where you're hiding. Second, text a mother, a father, text somebody, say, hey, I'm on the second floor, I'm hiding in this room, please send help. Now you're also helping police, letting them know where students are, and you're coordinating with someone, letting them know that you're okay. You should not be posting this also on social media, because this is happening. And so you don't know if there's one shooter, two shooters. You don't know if they're monitoring social media, so now they know where you are, where you're hiding.
And we saw one of the students earlier that George, in one of our pieces, said, I had my headphones in, I didn't even know. So you always have to be aware. And Dr. Jen, what type of mental health counseling is there out there, options for children who may be traumatized by this?
So much, and I think we need to remember that there are social workers, there are psychologists, there are psychologists, there are grief counselors, and they don't come in with lights and sirens. They're doing their work silently, and their work will continue for weeks and in some cases months, and they are saving as many lives as those first responders. So ask for help, because this is what they do. And I think as parents and as medical professionals, we have to remember that you can teach a child of any age, like Evy said, basic steps of what to do in an emergency, what to do when someone's choking, what to do when someone's bleeding, unfortunately, what to do in cases of an active shooter. And that information, that preparedness can be incredibly empowering for a child.
And many of these kids, Evy, they seem to know what to do. They had a drill about this a few days ago. What else do you recommend for parents to tell their kids to keep them safe?
As a parent, don't assume that the school is doing something, because some schools don't have a lockdown drill, some schools don't know what they're doing. You should be talking to your child direct. Ask them what's going on at the school. Practice at home with them. Again, age appropriate, as we're discussing. Practice scenarios at home, have discussions, and then dialogue with the school. Know what they're doing, and then reinforce those habits at home. Or maybe they're not good, and then you can work with the school to change those. But this should be a collective effort. Don't just rely on someone else to keep your children safe.
All right, Dr. Jen and Evy Poumpouras, thank you both so much for that.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.